Okay, so we're here with Michelle, who has some knee pain when she runs. She's a jock. She's training for her third marathon. Walking, going up the stairs is more painful, right?
Yes.
And just going up like 0 to 10, what do you normally get pain-wise?
A number?
Walking at home on your stairs.
Walking up on stairs. It's like a 5 or 6.
5 or 6?
Yes.
Okay. And then running during that first, when she first starts running, she feels a lot of pain. What's the pain grade when
That's
you start?
Like an 8.
An 8. Okay, so we're not going to be able to evaluate that until we make some changes. You go out running again, and next time you'll be able to evaluate that. But I thought just standing up on the chair, we'll just see. So go ahead and do what you're doing. Just kind of stand up on it. You can see how hard that is. She's flinching because she knows it's going to cause a lot of pain. Now do the other leg just to kind of see the other knee doesn't give her problems. And that was a piece of cake.
Yeah.
Okay. So we'll come back to that as a little test after we do our treatment. So we already did a full scan. It's not fun to go through the whole thing. So we'll just summarize. We found this. Hold there. And then we also found on both sides, that's the gastroc, the calf muscle. Go ahead and drop that down. And we found this. Hold right there, twisting. And both sides, she can't keep that leg in like that. That's the piriformis. So she also has a little bit of right hip pain, mostly at nighttime. When she's rolling over in bed, it kind of grabs her. What we found helpful from a systemic has to do with inflammation patterns, and then what that's going to do to her adrenals and things like that. So we just rubbed. Massage is a parasympathetic stimulation, and we're stimulating to the thymus gland, which regulates infections. It's your immune system. So we just rubbed, get a little stimulation in there, and you can see how much stronger that is. And then we found that tapping, so we're looking at systemic patterns that is creating a weakness that's causing your knee to hurt, and then we'll get in and treat the actual injury. And so we just tapped on the nose, so that's going to be your homework. You'll do some tapping and you'll do some rubbing. We found a stressor, and it was an infection. Now that could mean that you have an infection. That would be a weak link for you. Or it could be that there's a shift in your immune system that causes this to muscle test. So we go to the thymus reflex and we get a weakening there. And then we found a couple things that help the immune system, whether that's to kick out the infection or to just balance the immune system. And then there's no reaction there. So we'll do, so you do some tapping right beside the nose.
Okay.
So she's stimulating an organ system with simple acute tapping. And I'm massaging and soothing an organ system. Then to treat tissue injury, again, we just go in and hands-on healing. We look for the tender spots, and where she's having pain is kind of right where that ITB comes down, inserts in the knee. So if it's tender, we'll treat it.
There.
Yeah. So that didn't show up as an injury, as like, disrupted fibers, but it's still going to be stressed out from carrying the load of this muscle being weak.
Okay.
So it's straining
Oh, yeah.
to keep your knee moving in the right direction. And this will be part of her homework also. And then we always do click the ankle, pull down on the ankle after you treat. Just a simple reset to the cerebellum. And then we do the pain relief technique where we just pinch over where there's pain and push. And we get a weakening from that pain stimulation. And that's going to be 0.3 or 4. So you touch right here.
Okay.
And we'll pinch again and then push out. And that spot stops the weakening response. So you just start whacking right next to the eye. And then I'll go in and do a little more. So when you're doing that on your own, all you do is you just touch this spot and tap that spot.
Okay.
And then we'll check one more thing, then we check your stepping. Right side, correct?
Yes.
So we'll just go into these muscles and see if there's a little like stress and strain in those muscles. How's that feeling?
It's tender right there.
Tender?
Mm-hmm.
So same thing, we'll just treat that spot. Click.
Yeah, there.
Right there.
That's the worst.
Okay, so this one's pretty pinpoint.
Yes.
And click. Click. Let's flip you over. We'll just recheck the muscles. And up here, hold that in. Very strong. We'll check both sides of performance. Hold there. Very strong. And hold there. Very strong. Let's stand you up.
Okay.
And let me get this aligned on you to do that test again. Okay, so left leg up.
Left leg up.
All right, give her a shot.
Stand. Oh, wow. Balance wasn't good, but it didn't feel so bad.
You can touch the wall, that's fine.
Ah.
So the power's back. The pain is minimal.
Yeah.
All right, cool. So we've got a couple natural medicines to take to support that shift. But that's it.